So you're responding to a call of a baby that has fallen out of a bed.
Okay. BSI is my scene safe.
Your scene is safe, scene secure.
Okay. Per dispatch, it's going to be a fall, so I'm going to consider C-spine. I'm also going to get police and first responders en route. Uh, where's the child located? Is it in the house?
Child was in a house. He was sleeping in his crib and supposedly rolled out and fell on the ground.
Okay. Before I enter the room with the child in it, I'm going to do just a scene survey to make sure everything's safe. Do I notice anything peculiar as far as?
No, nothing peculiar.
Okay. So I woke up to the child. I'm going to assess for any life threats right now. What about AFPU? What?
Apu, he's kind of he's a little bit
He's grunting
sleepy
a little
looking,
bit.
kind of grunting a little bit.
Okay.
Yeah. You do notice an obvious big old swollen area over the right front lobe of his head.
Right frontal lobe. Is the
Uh-huh.
parents nearby?
They are.
Okay. I'm going to ask I'm going to ask pertinent information. While we're going to move, I'm going to have my assistants take him out to the truck. I'm going to follow as soon as I get the information. Is he allergic to anything?
He's not allergic to anything.
All right. Does he take any meds on a daily basis?
No, he doesn't. He's
How's
healthy.
his intake and output?
He's been normal. He's been eating today just like he normally does.
Okay. Does he have any past medical history?
No. Normal birth weight. Everything was good.
Okay. No congenital defects that y'all know of?
No.
Okay. I'm going to ask the parents to stay in the house while we go to the ambulance. By this time, he's obviously going to have him unclothed all the way to his diaper.
Okay.
As of right now, we're going to go ahead and get him on the monitor as quick as possible.
Okay. He's sinus around 140.
140. Okay. I'm going to listen to breath sounds while my partner prepares the 3 lead and the 12 lead.
Okay.
What do I hear his breath sounds is?
Breath sounds are clear. He doesn't have any trouble breathing. He's breathing probably about 24 times a minute.
Okay, I'm going to go ahead and get him on some oxygen if he tolerates that.
Okay. He can tolerate a mask. He's
Alright.
kind of withdrawing to you every time you mess with him.
All right. What about, do I notice anything on his extremities?
No decap BTLS on his extremities.
Okay. Do I feel good pulses here?
Yes, you do feel good, strong brachial pulses.
Okay. What about his chest? Do I notice anything peculiar as far as trauma or anything? What about his subcostal and intercostal?
No, there's no increase in work of breathing. I mean, his breathing rate's 24 to 26. It's normal.
Okay.
He's just he'll just grunt and pull away, and you notice just big, like I said, this big swollen area on the top of his right eye.
Okay. When I assess his pupils, what do I see?
It's hard to assess the right one. There is some blood that's kind of in there,
Mhm.
you know, around the sclera, but I mean, the left one appears to be normal.
Okay. Do I feel any decap BTLS on the neck or anything?
No.
What about his shape of his head? Is it normal for a child?
It is normal except for the right frontal
The
lobe.
right frontal lobe. I'm gonna go ahead and infuse
Okay.
some normal saline and lactated Ringers. The dosage for that is I'm also going to get a blood sugar and an IV.
Okay. So good blood sugar. Blood sugar is 135.
135. Okay. Did my partner get an IV or an IO?
Got an IV started, sure.
Okay. I'm gonna. Right now, I'm going to. How much does the baby weigh?
Oh, good question. How would you know that?
Broslow tape.
Okay.
I'm gonna,
And for him, we'll just say he weighs about 10 kilograms.
10 kilograms. Okay, so I'm going to infuse 20 mLs per kilogram. So total would be 200 kilograms or 200 milliliters. I'm going to use a Buretrol for that.
Okay.
All right, as my assistants or my colleagues are getting that ready and administering, I'm going to continue my physical exam. What about his abdomen?
Abdomen is soft.
Soft on
Mhm.
tender. Okay, the parents said he's been having good output.
Mm-hmm.
His lower extremities, do I feel good pulses in his lower extremities.
You may or may not, but assessing for him, what else would you want to know for except for pulses? If you can't feel them in a small child, what?
Cap refill.
Good. Cap refill's about 2 seconds.
Perfect. How's his skin color looking?
He's pink, warm, and dry.
Perfect. If I kind of stroke the bottom of his foot.
He'll pull back from you.
Perfect. Okay, so.
He's just still kind of altered and kind of withdrawn, but you've got him on oxygen. You know, you've got him on all those things.
Okay. So, where are we at? What county is this in?
Be Murray.
Okay. We're going to go ahead and transport emergency to Vanderbilt Adult or Vanderbilt Peds ER. Unless he declines en route, then we're going to detour to the closest facility. I'm going to assess my patient Q5. What do I notice about the wound to his right head? To his right eye?
It's pretty swollen. I mean his eye's swollen shut. His little area around that eye is just getting bigger and bigger. But it's
Okay.
not around his nose or his mouth or anything.
Okay, I'm going to contact my online medical control to see what kind of options they want me to do as far as an ice pack, anything like that to control the swelling. Do they advise me to do anything?
No. Is there any bleeding? No. It's just a large hematoma. So just let it be and come on.
Okay. Do I notice any additional signs or any signs of abuse, bruises in various healing stages, or cigarette marks?
No, you don't. Doesn't appear to be anything as you exposed him all the way down to his diaper. No.
Okay. I'm going to repeat the vital signs. How's
Okay.
his vital signs looking?
Blood pressure. You know, you may or may not get a blood pressure on a child, but radial or the carotid brachial pulses are still really strong. We'll give you a blood pressure 70/50. Heart rate is around 140.
How old is this child again?
He's about, I'd say he's about 6 months old. 7.
6 months old, so he's in that hypovolemic. Blood pressure could be a little bit better.
He's on the bubble. You're right.
When I check for blood pressure, what do I notice about his cap refill?
Cap refill's good, about 2 to 3 seconds.
Okay, do I feel that, or do I say that in all 4 extremities?
Yes.
Perfect. What about his trunk?
Everything's good.
Okay, I'm going to repeat breath sounds. I'm going to focus more so after I do breath sounds on his breathing, work of breathing.
Okay. No increases in work of breathing. His saturations are still good. He's about 96% on the oxygen that you got him on the mask.
Okay. How far away from the facility?
You're in time to give a radio report if you want.
Okay. Vandy Peds, we're coming in emergency traffic with a 6 months male, large hematoma to his right eye, above the eyebrow. It is closing shut as we speak. He's received approximately 200 milliliters of normal saline. All vital signs are within normal range. Weight is 10 kilograms. And that coincide, I'm going to say the Broslow tape size 2 is perfusing adequately, and cap refill is less than 2 to 3 seconds. Any further?
No.
Okay.
Anything else? All right, we'll see you on arrival.